Good morning, KSA, and welcome back to the programme. Of course, that was our report all the way from London, where we looked at our child welfare today. Of course, obesity in children. It's very, very sad to see, unfortunately, that we do have a number of children who suffer from obesity due to the lack of exercise, due to foods known as junk food and foods that are high in calories, all the pre-packed food that we sometimes give our children. We should be really, really careful, because not only can obesity be a problem, but it can also lead to other conditions like diabetes, high cholesterol. Can also lead to problems in the heart and a lot of different medical conditions that we would like to avoid. But today, nevertheless, we're talking about winter disease in children. We know that the winter brings on lots of diseases, not just for children but also for us. So we are concentrating on our children today. Allow me to welcome to the program Dr. Eihab, Ahmed, Hamid, who's of course a paediatric. What are some of the most common medical conditions in children, particularly in the winter?
If we are speaking about the winter diseases, especially respiratory tract infection or respiratory diseases, is the most diseases which is related to the season of winter, or it's occurring in the months of winter. This disease is divided to maybe upper respiratory tract infection or lower respiratory tract infection. Upper respiratory tract infection, which is included nose or pharynx or ear, like common cold or otitis media or pharyngitis. And also there is a lower respiratory tract disease, which is include the trachea, bronchioles, and the lung.
The bronchial asthma as well?
And bronchial asthma is a bronchial asthma, one of the most common disease in case in nowadays.
This is very interesting. Dr. Eihab, I mean, earlier just off air we were talking about bronchial asthma and how it's so common in the kingdom. I mean, why is it so common? Is it related to the weather? Is it related to the lifestyle? Triggering factors at home maybe that bring on bronchial asthma? What are the causes of this in children?
The most causes of bronchial asthma, especially happen in KSA, because of the sudden change of the climate and the weather. Also, there's the predisposing factors. There's many predisposing factors that affect the children in winter. Also, there is bad habits of smoking and the dust and large areas or trees or something. All this can happen or can occur with bronchial asthma. So that it's
very interesting. And so I think everybody knows that in the winter season you will get sick. I think it's very common for children and adults to get cold, flu, runny nose, whatever it may be.
Yeah.
But so what are some ways to avoid becoming sick, especially in children? Because I think children they face difficulties when they have these common colds or flu. So what can parents do, or what can family do to prevent their children from becoming sick?
I think the first thing we must, I want to mention that vaccination, one of the most effective method to prevent or to avoiding of most of the respiratory disease, especially the seasonal vaccine, the seasonal influenza vaccine. We can give it to our children before winter, and this can affect or can prevent most of this common cold or any diseases in respiratory tract infection.
That's good.
Also, avoidance of we keep it children, avoid keeping the children away from the other disease children on the using of masks if there are crowding or any disease, any child have respiratory tract infection. Also using of vitamin C drinks, which is full of vitamin C. Morning early, it is good. Before going to school or at morning, it's better to give the child the vitamin C as orange juice or lemon juice or apple, something like that.
That's very interesting. Dr. Eihab, speaking of the vaccine that you said is a seasonal vaccine, it can help to prevent the cold and the flu. I mean, what age can we give this to? From what age? I mean, can babies take this vaccine?
We can give influenza vaccine more than for the age of 9 months and more than 9 months. We can give it every year before the winter, in August or in September. I think it is better to give it to him. It decreases the incidence of, it will not prevent completely the influenza or other respiratory tract infection, but it can control or it can decrease the incidence of this disease or influenza disease.
Wow. So before the winter, but if somebody hasn't given it before the winter, can they still give it to their child now, or is it too late?
Sorry?
If somebody hasn't given it to their child before the winter, can they still give it to their child now, or is it too late now?
No, it's better. We prefer to give it before winter.
Right.
It's better to give it before winter. But if you give it, it will take immunity after from 7 to 15 days. You have immunity, and if you give it during this month, it's no problem. But it's better to give it before winter.
Very good. And sir, you mentioned something very important. You mentioned that the dry weather here in Saudi Arabia, as well as the changing weather, we're changing from summer to winter now, and of course there's a lot of dust, there's a lot of a dry season going on, and I really believe that the winter season is also another time where children suffer great allergies as well, or I think almost everybody has increase of allergies when it comes to the cold season. What can we do to control allergies, or what can we do to prevent allergies?
To prevent allergies, we must avoid all factors or anything can cause allergy.
Okay.
Allergy, like we must avoid become sick with influenza by a runny nose or something like that. We must treat it early to not develop to bronchial asthma. We must avoid all types of smoking, cigarette smokings or ash smokings or old smoking and all strong smellings. All smoking like perfume, like spray, like another spray for insects, something like that. All this can affect. Air fresheners. All this can affect the bronchial asthma people, and they can develop bronchial asthma.
Now, Dr. Eihab, speaking of bronchial asthma, and earlier you told me that if, let's say, our child has recurrent flus happening again and again, or recurrent tonsillitis and so on, it can develop to bronchial asthma. What are some of the symptoms of bronchial asthma in children, so that maybe the mothers watching us at home can actually have a look and see if their child has these symptoms and maybe get them some help?
The first symptoms of bronchial asthma is recurrent cough.
Coughing.
And recurrent cough or chronic cough or recurrent cough every month or every 2 weeks or every change in the weather or change in the or every when you're exposed to any of these predisposing factors like dust, like perfume, like when we notice that this baby or this child having cough recurrent and always the cough of bronchial asthma especially become in the night, become nocturnal asthma, nocturnal is what's called nocturnal cough, or in early morning. This is nature of the cough of bronchial asthma. Also there is in young infant difficult breathing with and difficult feeding. It's one of the symptoms of bronchial asthma in young infant. If we feel this baby is not feeding well or he has dyspnea or difficulty breathing during feeding, and this is become recurrent also, and it can repeat it many times, we can notice this bronchial asthma.
So maybe, I mean, for the mothers watching at home, if they notice that their child is coughing, should they first maybe give a cough medicine to see if it's okay? If the cough doesn't go away, then maybe they could have bronchial asthma, or what do you think?
For young infant, I think if there are cough, you must go to the doctor for young infant below 2 months. Cough is a serious symptom for young infant. For an older child, if it is a simple cough, acute cough come after runny nose, we can give a simple mixture for cough, and we prefer that natural mixture of cough. But in the recurrent cough, we must first search about the main cause of this cough.
Absolutely.
If it is this cough, because there is many causes of chronic cough, more than 2 weeks or 3 weeks, we must search about what is the original cause of this cough. It is cough and disease. There's many causes of chronic cough, as bronchial asthma, as cerebral fistula, like there is sometimes post-nasal discharge from nose. It can cause cough. All these causes, but if it is simple, okay, she can give him a simple mixture of cough. But if it is recurrent, I think it's better to go to the doctor.
That's very. I agree, sir, that if your child or if you, for example, have any symptoms of a cough or influenza or whatever it may be, I really think that yes, you should go visit a doctor. That's very important. But can you also give us an idea, sir, of what medicines should we keep ready in the house? What are some first aid medicines that everybody should have in their medicine cabinet?
For special for cough or for
For children.
symptoms of
For children in
common
general,
cold
for example.
For general children, I think the most we always searching about the most safe and the less side effect medicine.
Okay.
So for fever, for if we must keep for fever like the compound that consists of paracetamol. It's the most safe and the most has less effective, less side effect. Also the nasal drops of normal saline, normal saline, we must keep it in the winter.
So
for
the
the
salty
children.
based.
Yeah, it is good for cleaning or clearing of the nose and keep it of the mucous membrane of the nose is moisture, not dry. This is what we can use, but if there are high fever more than 2 days or 3 days, we must go to the doctor to see if there are infection. But I think there is one of the mistake of the other parents, they give antibiotics for
Straight away.
for mother. Yes, for the babies, just he has fever, and this is not good for the babies because most of the respiratory tract infection it is viral in origin.
Viral.
True.
It is viral, so it's no need. This viral infection is self-limited disease. It has its life cycle, then it's finished. So no need for antibacterial or for antibiotic only if there are or only when we are sure it is a bacterial infection. And it is too difficult to differentiate between the viral and the bacterial.
So what should parents do? Should they wait a bit? I mean, wait for a couple of days maybe?
Yes.
2 or 3 days before giving antibiotics or before?
Yeah, no. First, I prefer the parents to give paracetamol for 2 days if there are fever, every 6 hours or every 4 hours regularly, for 2 days or 3 days. Then stop it. If the fever is persistent or it's prolonged fever or there is other symptoms appear after this fever, so he can go to the doctor. He can consult the doctor.
Okay. Dr. Eihab, since we're running out of time, just very quickly, one final question. If our child is at school or in the nursery, for example, this can be, let's say, a major contributing factor to bringing home infections, because once a child is sick, the other child is sick, and it's like a cycle, and then the child will come home and bring the infection back to the family. Some tips maybe how we can protect our child in the home, some basic hygiene tips maybe that the mother can practice to keep the child, let's say, infection-free, and to keep the home more infection-free.
See, before nursery or preschool children, it's better first to give him all vaccines of children. You must take care of all vaccines, especially the seasonal influenza vaccine before going to the nursery or before going to the school. First thing, we must also care for the giving the children before going to the school. He must take his breakfast. He must take vitamin C included foods before going. We must care for avoiding, we must inform the child to avoid any sick or patient or any child is sick in the school by using mask, by using something like this.
Absolutely. Of course, with that, Dr. Eihab, like, thank you so much for joining us here and giving us important information when it comes to taking care of us and, of course, our children in the winter season. Thank you so much.
Thank you, and
Thank you.
I'm very happy to become with you today.
Oh, thank you so
Yeah,
much.
very much.
We hope we'll have you soon. Well, you guys, there you have it. Of course, if you want to take care of yourself and your children, there are simple tips that you have to follow, and please look out for symptoms when it comes to symptoms of common cold, flu, or any types of serious illnesses such as bronchitis and sinusitis. And you can always make sure to go up to your doctor and ask if you have any questions. Rushan, I will give you a brief recap of what are some of the most important medicines that you should always have in your medicine cabinets, as well, of course, what you can do when it comes to preparing and providing the right kind of food, which are very high in the proper